All right, thank you everybody for joining the Nierman Practice Management Tuesday Evening Study Group. We have here with us this evening Rose Nierman, the founder and CEO of Nierman Practice Management and creator of the Dental Writer software. So we're going to be learning about Medicare for the dental sleep medicine practice this evening. So thank you so much, Rose, for joining us and sharing your many years of experience with us.
Well, thank you so much, Courtney, for helping us get this together. I know we've got some people who are really excited to hear about Medicare. So.
Always.
Always, that's right. All right, let me tell you a little bit about Nierman Practice Management. I think most of you know about us, or you wouldn't be here, but we are the software provider of Dental Writer, which is the program that generates your narrative reports, your documentation, and your medical claims. We got some cross-coding manuals, and we do give seminars on cross-coding, also clinical seminars on dental sleep medicine and TMD treatment. So just a little bit about us. The important thing is to set up a repeatable system, whether you write your narratives by hand or dictate them, or you use the dental writers. It's so important to keep in mind that medical billing is all about documentation. And as long as you know what hoops to jump through, then you'll be fine. And that's what we're going to talk about today, specific documentation for Medicare, for dental sleep practices. And I'm Rose Nierman, and I'd like to introduce Courtney. You can go back to that slide, Courtney. All right. So Courtney's with us too for the discussion. And Courtney is our Director of Implementation. And so thank you so much, Courtney, for joining us today. All righty. First things first, Medicare DME, DME stands for Durable Medical Equipment, offers coverage for sleep appliances. Keep in mind that the dental practice must be enrolled as a DME supplier, excuse me, in order to bill Medicare. Keep in mind too, Medicare Part B offers coverage for certain other services. Medicare typically doesn't pay for TMD or bone grafts or implants. And so it's really important to know that if you're going to participate in Medicare, mostly what it's going to be for is for the sleep appliances. We don't see a lot of other things coming back, such as surgeries to dental practices, because not much is covered through Medicare. Now, keep in mind, DME is part of Part B, which are Medicare services. And so you cannot opt out of Medicare and be a DME supplier. More on that later. As you probably know, DME suppliers are not providers. They're pretty much suppliers, just like if you were supplying CPAP. And there's two types of Medicare, and one is what I call real Medicare, which is original or traditional Medicare. And you might run into some patients who have Medicare replacement programs called Medicare Advantage too. And on those Medicare Advantage, you want to make sure you treat those more like commercial insurance companies. For instance, you don't have to pre-authorize Medicare, but you might have to pre-authorize one of the replacement ones. Would be, you might see like AARP Medicare, United Healthcare Medicare. Those are replacement programs. So as I mentioned, your enrollment options are, you can opt out of Medicare. And if you opt out, the patient will be aware that they won't be billing any services, nor can you bill services. You can enroll just in Part B for services. Most of our doctors don't do that, and at least don't bill other services. Or you could just enroll as a durable medical equipment supplier. So you can do that. You can do a combination of the two. And, you know, so just, I think the first step is to figure out where you want to be with Medicare. Now, if you do opt out, that's a 2-year period. That means patient pays in cash. You want to make sure if you have opted out that the patient signs a private contract knowing that you're not with Medicare. And that means no one bills Medicare, not the patient, not the provider. So that's opting out. Now, Dental Rater software has a copy of the Medicare private contract. Again, this is telling the patient if you have totally opted out of Medicare, that Medicare is not going to pay. And so this is the form. It's a specific Medicare form. Now, to become a DME supplier, you must enroll in a form, the 855S, supplied to the National Supplier Clearinghouse. It takes at least 3 months, if not 5. They do want fingerprints. They do, NSC will come to an office visit just to make sure you actually have a facility. The application fee for 2019 is $586. And keep in mind, it's enrolled per location. You're typically going to need a type 2, which is the organizational, or what some people call the group NPI, to become a Medicare DME supplier. But it's per location. So if you have 2 locations where you'll be billing for sleep appliances to Medicare, you'll have to enroll each location. Oh, and something that just came up recently, the last few months, is now Medicare is requiring a surety bond for each location. So that's something kind of new. We do have a service here at Nierman Practice Management to help you become a DME supplier. It can get kind of complicated, so we're definitely here for you for that. Now, in November 2018, Medicare implemented new requirement for dental practice to have that DME supplier surety bond. Previously, until then, dentists did not have to do that and were exempt from this requirement. The surety bond must be obtained from a federally approved surety company, and you can contact us. We have a couple companies that we work with that we can send you their information. With the companies we work with, most practices are quoted about $250 or so for a year of coverage. Now, when you do sign up as a DME supplier, there's 2 ways you can sign up. One would be participating and one non-participating. Now, if you are participating, you must accept assignment. No balance billing beyond the co-payments and deductible. The allowed amount is 5% higher than Medicare's fee, called the limiting charge. And the check must come to your office. It doesn't go to the patient. Now, if you sign up as non-participating, which is what most of the practices we work with do, and the reason is you have a choice to accept assignment or not, claim by claim. So depending on the patient and the situation, you can say, okay, you're going to pay us in full for the oral appliance, and Medicare is going to send you the check, and you're not accepting assignment. Or if you tell the patient, gee, you've been a long-term patient, let's go ahead and I'm just going to go ahead and accept assignment. When that check comes to your office, that means you accept what Medicare pays. And so when assignment's not accepted, very important that the patient receives reimbursement. Now, once you get enrolled, you get something called a P10 number, all right? What you want to do is go to this site called PICOS. Medicare loves their acronyms, don't they?
They do.
They do. and enter your P10 number to connect it with your NPI number. Now, here's something I frequently see. We'll see that some of our practices have become a DME supplier, and we remember to tell them, you have to bill at least one sleep appliance, the code E0486, every 12 months. If you don't use it, you lose it. So that's important to know. So you got to get someone in, and it has to be on original Medicare, not a replacement program. So that's important. Oh, and the revalidation packet will be mailed about every 3 years, and you can re-up your Medicare every 3 years. Now, there are 4 different jurisdictions. Go ahead and find your jurisdiction because we can tell you what different fees are in those jurisdictions. 4 different places, contractors that manage the Medicare DME for Medicare. And Medicare, we'll talk a little more about what Medicare will pay, but what services will they pay for? The E0486, the custom oral appliance, everything's included in that from the initial visit through 90 days of follow-up care. Medicare pays 80% of the allowed amount, and I'll show you some amounts in just a second. And then the patient or the secondary pays the copayment of 20% of the allowed amount. Now, these are, if you were to accept assignment, these are the allowed amounts in 2019. So jurisdiction A has around 19 to 1950, B's, anywhere from 1250 to 1400, C's 1100 to 1200, and D is 1250 up to 1500, depending on which state it is. So again, a lot of our practices we work with sign up as a non-participating DME supplier, and keep in mind that way you can tell the patient this is what Medicare is going to send you, but you're going to pay us as fee for service. Now, what's the turnaround time for Medicare? Well, electronic claims are just very similar to commercial carriers, about 2 or 3 weeks. Paper claims are going to take a little longer. That's going to be 60 plus days. One piece of good news is that Medicare will build a supplement for you. If you put the supplemental info on the primary claim, they'll go ahead and take care of that, do the billing of the supplemental. Now, as far as the diagnosis codes, not only Medicare, but commercial carriers are only going to pay for one diagnosis code, and that is G47.33 for OSA, whether it's adult or pediatric. So that's the only diagnosis a sleep appliance will be, for which it will be covered. Now, as far as the procedure codes, remember, you're not going to be billing the exams and imaging like you normally can do with commercial carriers. So everything's going to be in the E0486 oral appliance used to reduce upper airway collapsibility. And where it says includes fitting and adjustment, that means that includes 90 days of follow-up care. So the calibrations of the appliance are included in the E0486. As I mentioned, it also includes the initial appointment, and we'll show you a claim. You do need to have place of service of 12 on the claim, since it's a device that patients wear at home. We'll show you an example of that. Now, there are a couple modifiers that help with payment, and they're actually required. Commercial carriers and Medicare are going to need the E0486 with the NU modifier. Since it's durable medical equipment, sometimes DME could be rented or used, so it's a carryover from DME. Not that you're going to be putting in a rented or used oral appliance, but like I say, it's a carryover because it's DME, so that is required. Now, with Medicare, you're going to have the E0486, and you're going to add the KX modifier. And that means that everything Medicare wants you to do, that you're following the guidelines and the required documentations on file. So you don't want to use the KX lightly. If you saw a claim and Rose said, okay, we're just going to send these in, and you KX. That KX means a lot. It means you read the Medicare guidelines and you followed all the rules. Now, I'm sure many of you have heard of it, ABN, Advanced Beneficiary Notice. This is where you tell the patient in writing that Medicare is probably not going to pay. And you only need to use it when it's something that would normally be covered, but in this case, it's not going to be. Okay, let me give you an example of that. Let's say the patient said, I don't want one of those Herbst type appliances. I don't want a Medicare approved appliance. I want that other one. But don't worry, I'm not going to file it to Medicare, right? And then what can happen is they might think, oh, we'll just send it into Medicare. So in a situation where it would typically be covered, it's not going to, have the patient sign the ABN. Very important. I need to give you another example before we move on that, because this is really, really important for our practices that are not DME suppliers. And that is, you want to use the ABN if you're delivering an oral appliance to Medicare Beneficiary and you're not a DME supplier. Okay, so that's Medicare says you just need to notify the patient it's not going to be covered. What about benefit checks and pre-auths? There's actually no pre-auth for E046, whereas with commercial carriers, you're going to do pre-auth all the time. The majority of cases, insurances will have you pre-auth. So that does make it easier to bill Medicare. Everyone is covered the same, but they have to have that Part B coverage and something I'll talk about called same and similar. So again, it's important to just know the coverage. They changed the Medicare card as of last year. And so you can see on the right, they actually took off the Social Security numbers and have a Medicare ID now. Now, speaking of Medicare guidelines, here are Medicare guidelines. And these can be found quite easily. Just, do a web search for Medicare oral appliance for oral appliances. And it's called an LCD, Local Coverage Determination. Now, here's the guidelines. The beneficiary has to have a face-to-face clinical evaluation by the treating physician prior to sleep testing. Okay, so you have to have a face-to-face with an MD. The beneficiary has a Medicare covered sleep test that meets Medicare's criteria. And if the patient only has mild sleep apnea, and commercial carriers have this in their policies too, you want to document excessive daytime sleepiness. That's the common Epworth sleepiness scale. Epworth sleepiness scale is what that's used for. Impaired cognition, heart disease, hypertension, history of stroke. So there's certain things you definitely want to document, especially if it's mild. If the patient has an HI over 30, which is of course severe, you'll need it to meet the following: that the patient is not either able to tolerate CPAP or PAP, and the treating physician determines that the use of CPAP is contraindicated. Now, the good news is the Medicare's guidelines are that the device must be ordered by a dentist, DDS, or an MD. But also keep in mind that once the physician orders the appliance, but what Medicare said is that the only provider that can deliver oral appliances is a DDS or an MD. Okay, so the dentist doesn't write a prescription, We're not really treating sleep apnea without the written prescription. So you want to make sure that device is ordered by a physician. And this is kind of a little known fact regarding home sleep tests. Medicare does say no aspect of an HST at all, whether it's delivery, pick up the device, training, may be performed by a DME supplier. Okay, so that's a lot of practitioners aren't aware of that. So you will not be using home sleep tests, diagnostic home sleep tests with Medicare beneficiaries. Now, as far as the face-to-face with the physician per the sleep test, physician is determined, at least by Medicare. Commercial carriers might vary. Medicare determines the physician could be an MD that writes the prescription or the written order, a DO, physician's assistant, nurse practitioner, or a certified nurse practitioner. Now, the detailed written order does need to include certain elements. Of course, the patient's name, prescribing physician's name, the date of the order. Description can be either a narrative, such as custom-made oral appliance for OSA, or it could be the code, E0486, or even a brand name model number. Of course, the prescribing physician's signature can't be a stamped signature or a scanned-in one. And the quantity, very important to have how many oral appliances. So that's where they get kind of picky there. Oh, there's the claim. This is a really good example of a Medicare claim. Now, keep in mind that it's the same claim form that's used by commercial carriers, that CMS 1500, but Medicare wants it filled out a little differently. So where you see the red boxes, it's going to look a little different on a Medicare claim than a commercial carrier claim. So on all claims, you just only want the first and last name of the ordering physician. Prior to that, DK means next I'm going to tell you the ordering physician. And as you can see on the right where it says none, if the patient is the insured, you're just going to put none. And there's no rendering NPI, which is the doctor, the provider who actually performs that service in field 24, that little box on the right. Now, the good news is that Medicare sets your defaults. So if a dental writer knows it's a Medicare DME claim, it scrubs it. It fills it out the right way.
Now, a lot of you on the line may have heard about or maybe even run into this with one of your cases over the last little over a year, and that is the same and similar equipment clause. With Medicare, they do consider custom-made sleep appliances and CPAP or BiPAP machines what they call same and similar equipment. So if you have seen a denial remark from a claim that says equipment is same or similar to equipment already being used, then you've run into our same and similar clause here. Now, a little misconception we do want to clear up about the same and similar with CPAP and oral appliances is that you may have heard that, oh, Medicare won't pay for an oral appliance at all for 5 years if the patient has had a CPAP. And there is actually opportunity for reimbursement if the patient has had a CPAP within the last 5 years. However, the patient would have needed to return the CPAP and been prescribed the sleep appliance in order for that to be available. Now, a big question is, how do I know if the patient has had a PAP machine, a CPAP or a BiPAP, in the last 5 years? What if the patient doesn't remember? So the great news is you can actually verify through the IVR, which is the phone system, the interactive voice response system that you can use, or if you have registered for a provider portal with your Medicare DME jurisdictions site, then you can check it on there as well. So just a heads up, if you've never checked out the online login, it's a great resource for staying off the phone with Medicare and being able to do your eligibility, same similar checks, checking claim status, and all kinds of fun stuff. So the only catch is you do have to have at least one claim processed through before you can request a login, because they'll ask you some identifying information from a recently processed claim in order to verify your identity. So the codes that you're going to be checking against, the one we discussed for the sleep appliance, the E0486, there's two different codes, one for CPAP and one for BiPAP, E0601 and E0470. Now, if you do run into a same and similar situation, what's the best way to handle it? Well, the first thing is, if you are wanting to make sure that the patient is going to receive coverage or hope to, the first thing that would need to happen is that CPAP or BiPAP machine would need to be returned to the supplier. And a return receipt is extremely helpful. The patient, whether just like whether they had been on CPAP first or not, would need to have that face-to-face with a physician, and the physician documenting the intolerance to the CPAP is an excellent thing to make sure gets done there. Now, when you run into a same and similar situation, as Rose mentioned, you want them to have them sign the ABN form. And so you will fully be expecting Medicare to deny the initial claim, okay? So you want that ABN to show that the patient was informed that Medicare may deny it. Now, once you receive the denial from Medicare, that's when you're going to respond with an appeal to it, or what Medicare calls a redetermination. Now, whenever you send in the redetermination form, you're going to have to include some supporting documentation, just like with a lot of things in medical insurance. So some things that you're going to need to include, for example, the copy of the sleep study. And for Medicare, that does need to be within 12 months prior to the delivery date of the sleep appliance. You'll want to include all of those fun things we were talking about on what Medicare requires, a copy of the detailed written order or prescription from the physician, including a copy of your narrative report or SOAP notes from your evaluation is extremely helpful. For example, if your patient is diagnosed with mild sleep apnea, we saw in the coverage criteria that Rose shared with us that Medicare wants to see one of those comorbidities in order for the patient to qualify, like hypertension, history of stroke, things like that. You'll also want to include a copy of the proof of delivery form, which is the form the patient signs the day they receive the appliance to prove that they do have it in their possession. And then those face-to-face notes from the treating physician and a CPAP intolerance affidavit if applicable. And here is a peek at that redetermination request form for DME or durable medical equipment. This might be one of the only ones, Rose, that is a one-pager Medicare form, I think.
Isn't that the truth?
Right. So the great news about it is you're seeing it in its entirety here on the left-hand side. So it is pretty straightforward to fill out, but you do want to make sure you include all of that supporting documentation we discussed. And a big question we get is, well, when I'm sending in a redetermination because the patient, we ran into a same and similar issue, what am I supposed to put as the reason? So we put a little example up here for you where you may have something listed like the claim was denied due to same similar equipment. We're submitting the redetermination because the patient was intolerant or non-compliant to PAP therapy, and they've already returned the CPAP machine, and no supplies are currently being ordered, and the physician prescribed this. Now, you've also heard us mention the proof of delivery form. There is a nice little quick letter template in the Dental Writer software to help you out with that too, because you will want to make sure that your Medicare patients sign one of these each time you deliver an appliance to the patient. Now, another item that you'll see in Medicare policy, and you probably have heard some buzz about this, is that Medicare does have a classification list for the type of appliance that can be used for custom-made sleep appliances. So this is called the PDAC list, and you can search this list at any time by visiting DMEPDAC.com. And if you navigate to the product classification list and search for the code that we use to bill sleep appliances, E0486, you'll see the list of appliances and their manufacturers that are approved for coverage for Medicare. So I know that the list keeps growing every year, so the font gets smaller and smaller on our slide here. As you can see, there are several different options available, and they've been being slowly added over the years since 2012. So our most recent addition was just recently in August 30th, on August 30th, excuse me, of this year. The Kava Herbst by Sketchpad Innovations was added, but you can see that we did have several additions in 2019 and 18. Many of these appliances are Herbst or, tap-style appliances. The types of appliances you will not find on this list are any that don't have a fixed mechanical hinge. For example, any dorsal style appliances you won't find on this list.
Yeah, and I'd like to pop in here at the cross-coding course this last weekend. I had quite a few practices tell me that the commercial insurers are asking for sometimes the model number and the even the lab, the manufacturer. Because as you may be aware, some of the commercial carriers, I know United Healthcare and some of the Blue Cross Blue Shields have gone with the PDAC cleared list. So that's important to know. If when you do your insurance verification call and you check with even the commercial carriers, ask if they require a PDAC approved appliance. And then you will want to include as much information as you can in your SOAP note.
Now, a little known fact that we really wanted to draw to everybody's attention this evening is that you'll find a little variance in Medicare's policy for the AHI or RDI AHI and RDI calculation. So the AHI, or the apnea-hypopnea index, is what you'll see referred to in many medical policies, both in and out of Medicare, which is the number that indicates the severity of the patient's sleep apnea, or obstructive sleep apnea. So just, you want to keep an eye out if you have a sleep study where you are counting on the RDI number for the patient to meet criteria. You want to be wary of that, because what Medicare has done in their policy is put some additional clarification around how they define RDI. So AHI is the number of apneas and hypopneas added together and divided by the total number of hours of sleep. So we get an average number, basically, that the patient is having these episodes each hour. Now, RDI is very similar, but it also includes an additional set of events called RERAs, or respiratory effort-related arousals. So what you'll typically see with many patients is that the RDI is going to be higher than the AHI if you see both of those numbers on the sleep study report. Now, the reason this is so important is what you'll find in Medicare's coverage policy is that they define the RDI as saying it's actually the average number of apneas and hypopneas without use of a CPAP device. So for the purposes of our policy, those RERAs, those respiratory effort-related arousals, are not included in the calculation of RDI. Okay, so they basically have said in so many words, we're going to make the definition of AHI and RDI the same. So, you know, you do want to make sure that the patient's AHI is 5 or above for Medicare.
Well, you certainly explained that better than anyone I've ever heard.
Well, thank you.
You're welcome.
Now, let's take a look at some of the not so common scenarios that we run into. We've taken a look at, you know, how to get enrolled in Medicare to build these things, how to verify eligibility, and how to fill out that claim form, and even deal with a possible denial for same and similar. So let's talk about a few other more out-of-the-box type scenarios. So once you have, you know, been delivering appliances to patients for some time, you may run into some situations where you need to repair or replace the appliance. So the code that you will use for repairs to the appliance is K0739, which stands for a repair or non-routine service for durable medical equipment other than oxygen equipment. Now, this code is billed in 15-minute increments. Now, if you get to the point where you need to replace a sleep appliance, keep in mind Medicare will pay for a replacement sleep appliance every 5 years. So just like we've been talking about with the same and similar equipment, that 5-year period is going to apply for new appliances too. So if there is a situation where a replacement is given before that 5-year period, you may be looking at the RA modifier, which stands for replacement of a DME orthotic or prosthetic item. Also, the RB modifier is for replacement of a part of the equipment or orthotic or prosthetic item. Now, when you're sending in for a repair, Medicare does specify some documentation requirements in their policy. And number one is that the treating physician must document that the item continues to be reasonable and necessary. And either the treating physician or the supplier must document the repair itself is reasonable and necessary. So this is, again, where the SOAP notes or narrative reports come in such handy if you ever find yourself in a situation where they're looking for additional info. Now, another not so common scenario we run into is, how do we bill for a sleep appliance if we have already taken the impressions, sent it off to the lab, and it's made, and the patient never comes to pick it up? Okay, of course, it could be just the patient refusing or passing away, unfortunately, before we have the chance to do that. But for whatever reason, the patient's unable to get that equipment delivered, you do actually still have the opportunity to get that billed out because, of course, these are custom-made appliances. As Rose mentioned, we can't really, refurbish these things and pass it on to the next patient and get them all cleaned up. So they are custom-made. So and what you would do if you run into that situation is you'll go ahead and bill the claim just like you would usually bill for the full amount and the date of service on that claim. Typically, we put the date of service as the day the patient receives the appliance. Make sure you keep an eye on that too. We do run into practices every so often that say, oh, I thought we were allowed to bill on the impression day, when we take the impressions and bite registration. And that is not the case. It should be the day that the patient gets the equipment, or in this case, sleep appliance, in their possession. So if we haven't delivered it, we need to make that date of service the date of refusal or the date of death for the patient. Okay. If the patient does refuse to come pick it up, make sure you document that well, the attempts that were made and all of that. Now, you'll just include a brief description, a narrative description explaining the situation and, letting them know that because this appliance or equipment is custom made for a specific patient, it has no salvageable value and is a complete loss. Now, we took a look at the list of PDAC approved appliances earlier for Medicare. So what happens if the patient gets a different type of appliance? Whether, the doctor or patient insists that we need a different appliance for that patient. Per the Medicare LCD, per Medicare policy, they do stipulate that a different code completely would need to be used in that situation, and the code is A9270. And funny enough, that code stands for non-covered item or service. So, but right in the LCD, it's very plainly written, all custom fabricated mandibular advancement devices that have not received a written PDAC verification review must use HCPCS code A9270, okay? So you can expect a denial on that, of course, but, that's the proper way to code that situation. Now, on the flip side, let's say it's actually the patient that doesn't meet criteria. Maybe you have a severe patient that has been diagnosed with severe that has not tried a CPAP and tried and failed a CPAP, and the physician did not deem them contraindicated. Or maybe you have a mild patient that actually doesn't have one of those qualifying comorbidities. What do we do then? Of course, anytime a supplier has reason to believe, this dental practice in this case, that Medicare will not pay for the equipment, we're going to have the patient sign that ABN form we've mentioned so many times this evening. And so as long as the patient has signed the ABN where you're saying, look, heads up, we're telling you there's a good chance this claim is going to get denied because of this criteria that you don't meet, or whatever the case is. then you're going to use, instead of that KX modifier that Rose mentioned earlier that tells Medicare that we do have everything on file, that the patient meets criteria, you're going to use the GA modifier here, which means that indicates to Medicare that the patient has signed that ABN form. Now, let's say the patient doesn't meet criteria and whoops, we didn't get an ABN form. I hope nobody ever has to use this one, but the modifier for that is going to be GZ, okay? So you're going to use one of those three. I get the question a lot, can I use all three? Can I use the modifier NU for new equipment? That's kind of the default one. And then can I use KX and GA? Because I do have everything on file, but I had them sign an ABN. No, it's going to be either GA, GZ, or KX. Hopefully in most situations, we've got that KX modifier, but anytime the patient has signed an ABN, you want to use the GA modifier. And another peek at that advanced beneficiary notice here with some example language filled out here. So, you know, again, it's just a nice statement where the patient has indicated that they were informed that this service or equipment, in our case, may not be covered. So for this example here, we've told the patient that, oh, well, we had you sign this ABN because you have severe sleep apnea and you're just refusing to even try the CPAP, and your physician did not say you're contraindicated. You just are not doing it. So we don't have the required documentation. Now, the patient does have three options to choose from. You'll see there at the bottom of the slide. So option one says that the patient still wants the service or equipment, and they understand that they're responsible if Medicare ultimately denies this, okay? Option two, the patient can say, yes, I want this, but don't bill Medicare. We'll just make this a cash pay deal. Don't bill Medicare. And the third option is, actually, never mind, I don't want this anymore because I want it to be covered. Now, you cannot choose an option for the patient. The patient does need to select the option themselves. All righty. So, yeah, thank you, everybody, for joining. We're going to get to some of the questions we have there rolling in through the Q&A box and the chat box in just a moment. But thank you for, you know, hanging with us this evening and learning some more about Medicare. And if you want to learn more, not only just about Medicare, but medical billing and dentistry, or sleep apnea, or TMD, we have some wonderful seminars that are hosted throughout the country. We've got a little screenshot of the ones coming up here over the next few months, and some wonderful speakers, Dr. Suresh Charkanda and Dr. Mayur Patel there. Actually, Rose, that you have been listening to this evening, she is the host of all of our cross-coding seminars, so she's just a wonderful educator, and we get nothing but, you know, great reviews on her. So we hope to see everybody at an upcoming seminar. With that, we're going to go through just a few questions in the chat box here. And if your question doesn't get answered, you can hang around after we finish up the session here, and we will respond to, if you're still on signed in, we'll go ahead and respond to your question, or we'll follow up with you via email if you need to get going. So with that, the first question, Rose, where do I get a redetermination request form?
That is a specific Medicare form, and so you can certainly find that on Medicare's website. I find it easiest to find a form on Medicare just to do a web search rather than go to their website and get kind of complicated clicking around. But that is an official Medicare form.
Yeah, and for those of you with the Dental Writer software, if you have installed the latest update, we do have the redetermination form as a quick letter template available for you too. In the quick letters tab, in any patient chart, you'll be able to find that. And very quickly, I do see several questions in here asking if we are going to have a recording of this available. So yes, there will be a link to a recording that will be provided to anybody who's in attendance this evening via email. So no worries, we've got you covered on the recording. All right, next question here. Rose, do you recommend billing the consult and delivery of the appliance on one claim?
Oh, that's a great question. I would say that the majority of the practices hold the claim until the appliance is ready. And you can put different dates of service on the same claim. And that way, when it goes in, you'll have all your documentation there. Although it's perfectly fine to just bill the claims as they come in as well.
And also keep in mind for Medicare specifically, Medicare does consider that initial appointment for sleep appliances included in the reimbursement for the E0486. So for Medicare specifically, you don't want to, put that office visit code on the claim. And
yes,
even if you do, Medicare DME won't process that type of code. They'll only process equipment codes.
That's right. So yes, you can bill it separately on the same claim, but you're right, only on commercial claims, carrier claims. I see a question here. Can I bill a Medicare replacement or Advantage plan for the initial visit and radiographs? Now, what I do is I treat those replacement or Medicare Advantage as almost like a commercial carrier. As I mentioned, you don't pre-authorize Medicare. You check on a couple things like same and similar. With commercial carriers, I'm going to do an insurance verification. I'm going to give them the codes. And it can vary quite a bit because they sometimes, as you know, say, well, we offer more benefits than original Medicare. And that's how they get patients to sign on. That said, I think the majority of them would include it all in the E0486, just like Medicare does.
Great. Another question here for any latecomers that may have missed this portion of it. I do want to bring this one up again. Is there no coverage if the patient has been prescribed a CPAP machine within 5 years? And what if they, complete an intolerance form? So that's a great question. We were talking about the same and similar clause where if a patient has been prescribed a CPAP or a BiPAP within the last 5 years, that you will see Medicare issue a denial for the claim. But the good news for you is that doesn't mean that there is no chance of coverage for the sleep appliance. There is a chance at coverage. However, the patient would need to have returned the CPAP machine, and getting a return receipt is always a great idea. So you can use that for the redetermination after you get the denial. But basically the idea is just go ahead and expect the denial on the initial claim and have the patient sign an ABN. But there is still a chance at coverage, but not if the patient is currently using their CPAP machine or if they never returned it for some reason. They do need to return it. Okay, and another question here. Do you need to apply for the surety bond before applying to be a DME supplier? So great question. That is something that you will do more on the front end. It is part of the enrollment process. So when you submit your application, that 855S application to the National Supplier Clearinghouse to enroll your practice as a DME supplier, the copy of the surety bond is going to be one of the things that you want to include in your supporting documents. And follow up on the same question there is, if you have applied to be a DME supplier, do you reapply? If you have applied to be a provider, do you reapply to be a DME provider as well? So I'm not sure if I understand the question fully, but basically you do need to enroll as a DME supplier, whether you enroll as participating or non-participating, in order to get reimbursed for sleep appliances. And you do reapply, or what's called revalidate, approximately every 3 years. Medicare actually sends you a packet in the mail and says, hey, it's revalidation time. You can also manage that through your online PICOS account if you prefer to do that online. All right, I think we are at the end of the hour here, so thank you everybody for submitting your questions. I know there's a few left still in the queue here, so I'll make sure to type answers back to just as many as we can, and if you need to get going, we'll make sure to follow up with you via email. So thank you again so much, Rose. I think there was a lot of great information shared, and hopefully it'll help everybody get moving in the right direction with Medicare. So thank you again for all of your time and expertise.
You're so welcome, Courtney. My pleasure. And thank you as well. Everyone have a great evening.
Thank you. Good night.
Good night.